Hi, everybody. This is Dr. Patel. I am the Director of Admissions here at Texila American University. Today, we are having a really special interview with the Dean of Medicine, Dr. Dheeraj Bansal. And I'm excited to talk about not only our program, the medicine program, but also get some insight from Dr. Bansal about what he thinks the program and the students here and the structure of the program and how it can benefit our students to pursue residency down the road after they're done medical school. So welcome, Dr. Bansal. How are you? And if you could tell our audience a little bit about yourself.
Thank you, Dr. Patel. Thanks for having me here. And I'm doing well. Hope the same for you as well. I am the Dean and the Chief Academic Officer here at Texila American University College of Medicine, and I look after the MD program. My responsibility is to look after both the basic science and the clinical science part of the program. So I oversee the student from the time they enter to the time they graduate and leave. I think we are doing an excellent job here,
That's great. And so just to give everybody a perspective into what your day-to-day looks like or how you think about the MD program, can you briefly tell us what students should expect when they come to Texila?
So our goal is pretty simple here. We keep it simple and we keep it focused. Our aim here is to prepare a student well for any licensing exam they want to go for, USMLE or PLAB or any other exam for whichever country they have come from. I would like to share here that our student diversity is awesome. We have representation from nearly 26 countries. So some of them go for USMLE, some of them go for their own respective licensing exam. So our goal is to prepare them for whatever licensing exam that they want to apply for. Our main focus is on USMLE because our curriculum is designed according to that. So our goal is pretty simple. First, that they are well prepared for USMLE exam. Second, they get the necessary clinical skills and clinical knowledge to make them a good physician. Third, not only they are good doctors, but they're good researchers as well. And fourth, I would say that they realize the importance of the community and we prepare them to be good community leaders. So that's a 4-point focus program that we have for our students here.
That's excellent. And one of the things that I think about all the time in admissions is, which student is going to be the most qualified to succeed through the MD program. But a lot of the times what we tend to forget is that there is some prerequisites to get into medical school programs. So everything that you mentioned, the basic sciences and the clinical sciences, that's in the medical school. So if a student or a parent was thinking about the academic progression for getting into medical school, what would you tell them? How should they prepare to compete to get into medical school?
So like any other medical program, our criteria are very simple. They need to have the basic knowledge about biology, chemistry, physics, some of the basic courses they're exposed to in school. We look at their GPA, how their performance was, but that's not where it ends. We also look at their personal letter. So academic excellence is not the only thing we're looking for. We also look at their personality. We look at how passionate they are about joining a medical program, and we give a lot of importance to any community volunteer work they have done, or they have done any kind of research work. So those also get a lot of value. So the admission process is not focusing only on their academic performance during their school years, but we also give importance to these other things that we talked about. Because I I personally believe that if the student is passionate about doing something, then you can make successful physicians out of them, even if they were not academically excellent to begin with. I guess that's what I'm trying to say. So to answer your question, a student should have done some community work that always gets them points. They should have done some research work that also gets them points. And then overall, above average academic performance, I think would be a good candidate for us.
Excellent. I think one of the really important things that you mentioned is that they don't have to be perfect students is basically
Exactly.
what I know that they can and we have the structure here at Texila to be able to mold them into the physicians that they're going to be, and you play a big part in their day-to-day for that. So I want to transition to the academic structure of the program once the students get to campus. So if you want to tell us a little bit about the day-to-day of a student and the importance of the basic sciences, and then life on campus with students, and then we'll transition to clinical sciences afterwards.
So our program is like any other good medical school program. The whole program is divided into two halves: the basic sciences and the clinical sciences. And as I was telling you earlier, not only we cover all the major courses in basic sciences, but we also try to get that balance between clinical knowledge and clinical skills. So in our program, so our curriculum is like any other medical school curriculum, but there are a couple of unique things which I'm very proud of as the dean of the institution. The first thing is a course called Doctor-Patient Relationship, DPR, and it runs from MD1 all the way to MD4. So in this course, which is given 4 times during the entire basic science curriculum, we prepare the students to have good clinical skills, because we believe, as I said earlier too, that clinical knowledge is not enough. Good clinical skills are also needed to become a good physician. And we expose them from day one to these clinical skills. We begin small, with history taking, and then move on to physical exam, and then investigation and diagnosis and things like that. And this is a purely skill-based course. There are no MCQ exam for this. They are graded based on their clinical skills, which I think is very unique for us. And the second unique part of our curriculum is a course which we call as research methodology. This course runs in MD1 and MD2. And again, in this course, we expose them to the different ways you can conduct a research project. And each student, it's mandatory for each student to conduct their own original research. And the final product in MD2 is actually a scientific paper. Again, no MCQs, no exam. The grading is purely on the work that they have done on their research product. And I'm very proud to say that majority of our students who do this project end up getting a publication out of it. So you can imagine that while they are finishing MD2, they already have a publication, a good publication to their credit, which will give them a lot of confidence to become a good researcher, which will give them confidence to do research on their own later on. And it will help them immensely with their residency application, because as we both know, that these days for residency interviews, they give a lot of importance to original research work that they do. Absolutely. So, yeah.
Yeah, I think you hit the nail on the head there, because in addition to what you said, being able to read through research studies in practice and being able to present it in grand rounds and then being able to present it for a specific disease, that becomes very important. How to evaluate a research paper, how to read it in your day-to-day when you're in practice versus when you're in school, it can be very different. So getting that early
absolutely.
exposure.
There's so much research work being produced. You can easily get misguided if you don't have the skill to know good research from bad research.
Yes.
So I think, again, as you rightly said, not only to conduct research, but also to understand research, this kind of exposure is essential for a physician in making.
Excellent. So I wanted to double click on something else that you mentioned earlier, which was that students get early exposure to clinical skills in the DPR course, in the doctor-patient relationship course. But we also have simulation labs on campus. So can you tell us a little bit more about the importance of having simulation labs along with a course like DPR, which is run in parallel with all of their other basic sciences, and how important that is to their performance down the road once they get into clinical sciences?
So yes, I mean, thanks for bringing that up. Simulation lab is a huge part of our DPR courses. And as we all know that during basic sciences, there is minimal patient exposure. So having said that, our students do go to hospitals. They do go to hospice care. They do go to a psychiatric facility just to get exposed to the setup. But, when they are learning their clinical skills, they are not able to practice it on actual patients because that will come later on when they go for clinical sciences. So simulation lab helps us there. For example, we are teaching them murmurs, the murmurs of aortic stenosis, murmurs of mitral stenosis. No matter how good a teacher you are, you cannot make them realize how it actually sounds.
Yes.
Or how do the lung sounds, the crepitation sound. So this is where simulation lab comes in very handy. So whatever we are teaching them in these DPR courses, then we reinforce that by taking them to the simulation lab, making them listening to the actual sounds of heart, of lungs, of abdomen, and things like that, so that they get the real feel, of those clinical findings. And when they go to clinical hospital, they're already exposed to those clinical signs and symptoms, which will help their performance a lot when they go for their clinical rotations. And we are already seeing the good feedback that is coming, from the clinical site.
Excellent. That's perfect. One thing that immediately kind of comes up in my head for a follow-up question is that, medical school historically, and I think popularly, everybody thinks that, okay, it's very difficult, and it is. Don't get me wrong, it is difficult, but you need the right environment to be able to learn these difficult skills that you can apply later. So the question that I'm coming to next is not only testing itself and your view on how the structure of examinations and the importance of examinations is, and if you could also talk about the USMLE preparation for students that we have on campus.
Before I go into there, I want to mention something else which I forgot to mention earlier, is that other than DPR and research methodology and simulation lab, we have a huge community program module as well, in which our students from basic science, actually, along with clinical science students, go to these communities and interact with people, talking to them, understanding, what they feel and what their needs are and things like that, which I think is a very good initiative to make them understand what the community needs are. Moving on to the USMLE part that you asked. As I said, our entire program is designed to prepare a person for USMLE exams. I can very confidently say, coming back to what you were saying, that, how will you prepare the student who come in? I can confidently say that a student who comes in and do their part, going through MD1 to MD4, and then transition semester, which I'll also talk about in a little while, the person is spontaneously, automatically prepared for USMLE exam one. They don't have to take time off to prepare for it. So all our final exams for all the courses, starting from MD1 anatomy, physiology, all the way to pathology and pharmacology in MD4, all the final exams are NBME exams. And NBME, as you know, is the same body that writes USMLE exams as well. A student goes through NBME exam for all the courses that are being offered in basic sciences. Each course has USMLE question-based sessions of 2 hours from time to time on a regular basis, so that students are exposed to what USMLE questions look like, how do you approach them, how do you pick the right option. There are dedicated sessions during the entire curriculum to that. Each pedagogy session, each lecture is followed by few USMLE style questions, MCQs, on the topic that was taught during that session, so that students know what kind of questions to expect from this particular session. These are the things we do during basic sciences. Then a part of basic sciences, MD5 or transition semester. During transition semester, the student go through a USMLE review program in its entirety, which means they go through all the subjects from anatomy all the way to pathology once again. There are assessments for each subject. As they do the subject, they have to take assessments and evaluate their own performance. There is a comprehensive all subject inclusive exam in the beginning of transition semester and again at the end of the transition semester. So not only we are assessing them subject wise, we are also letting them evaluate where they stand at the beginning of transition semester, so that they know which subjects they have to focus on more, which are their strong points, which are their weak points. And they do it again at the end of the semester to see the change, how far they have come from where they started, which gives them a lot of self-confidence. Mm-hmm. After that, the students appear for what we call a CBSE, Comprehensive Basic Science Exam, which everybody knows is the best predictor of the performance in USMLE because it's written by the same body. So they go through CBSE exam, and experts say this, that if your performance in CBSE is above a certain level, it's pretty much guaranteed that you're going to clear your USMLE step 1. And we have seen that, students doing that here. So that's how we have designed the entire course towards USMLE. And as I was saying earlier, I will say that again, that all you have to do is show up and do your part, and spontaneously, naturally, you will be ready for USMLE by the time you're done.
That's perfect. I think that's exactly what a lot of people, when they're considering an international medical school, for example, they think that, okay, my structure, my pathway to doing some of the board examinations may be different. Do I pick a certain school because they have a specific type of board examination prep course that's attached to it, or will my learning be different from a student who is going to, say, a competitive medical school in Canada or in the United States? And that's totally not the case, which is really to kind of put into context for students who are thinking about going to a medical school internationally, and especially thinking about coming to Texila, is that, you know, you'll be the standards of medical school don't change. And as Dr. Bansal mentioned, we are here, and he is there to provide the support so that as long as you show up to class, as long as you bring your A game to campus, there's a very good chance of you to succeed and go on to residency afterwards, and then practice later. Mm-hmm. I wanted to and you brought this up earlier too, so I'll ask you, can you tell us a little bit more about the clinical sciences? I know that they get exposed earlier in the basic sciences, but for our audience, if you could tell them what they can expect when they get into clinical sciences.
The dean for both basic science and clinical sciences, that I can make the connections, which many schools are not able to, because they have a different dean for basic science and a different dean for clinical sciences. This is something unique for us. Here, the dean is for the entire program. So it's very easy for me to make those connections from basic science to clinical science. And I already explained to you what we do in basic sciences. So when they move on to clinical sciences, they are already exposed to the basic clinical skills. They're already exposed to some of the basic cases. They're already exposed to the basic investigations that we do. And during basic sciences, they have these hospital visits during basic science as well as during transition semester, in which they go to different hospitals and they spend an entire day there talking to them, talking to the nurses, talking to other healthcare providers, including the clinicians, to get the idea of what the environment is like. Our clinical rotations are done at 2 sites. The major site happens to be, the top hospital in the country in Guyana. It's called GPHC, which is the tertiary care hospital, 800 bedded. All the specialties are there. And we also have a clinical site in US in Arizona. It's called Morana Healthcare, which is again a multi-hospital organization, a network rather, a multi-hospital network. Again, students are exposed to all kinds of specialties there. Number of patients that they get exposed to and the variety of cases that they get is unbelievable, which is one of the biggest strengths of our clinical program. They're exposed to a range of conditions because it is the main hospital of the country. So all kinds of cases, whether it's infectious disease or non-communicable disease or complicated cases, everyone comes there. So the kind of exposure the student gets here is unbelievable. And I think that is one of the major strength of our clinical sciences program. It's a very hands-on program. The students are able to interact with the patient one-on-one, do the examination, they're supposed to do examination on them. So everything is very hands-on, and our faculty are really good in giving them the free hand to do things on their own. The students are part of the grand round. They're part of the case presentations in which they are asked to contribute. They are the first one to respond to any patient finding and things like that. So it's a very comprehensive program, I would say, and with the variety and the number of cases that they get exposed to, I think it makes it really, really good program.
Yes, I'm so glad you mentioned the volume of patients, because I think in the rumor mills of international medical schools, I think what you tend to hear is, or a narrative that's there, is that, oh, did you get enough clinical exposure as a medical student? And I'm glad that you touched on it here, because students that are considering, or students and parents who are considering Texila as the medical school of choice for them, they know that they can rely on not only the basic sciences that's going to build the foundations for their education, specifically in med school, but also get early exposure and then reinforced learning in the clinical sciences, which is going to help them down the road when they're competing for residency.
Absolutely.
So now I kind of want to dive into, as we're closing our discussion here, what I wanted to ask you is specifically about advice that you would give, not only to a student that is considering Texila American University, but generally medical school. But if you could also provide some advice to parents who are thinking about helping their children choose a medical school, whether that's a domestic program or an international program like ours. So what would be your advice for both the parent as well as the student?
A parent, because I'm a parent too. So I think as a parent, whenever you're looking for a medical school program for your children, uh, first thing that you should be looking into is whether the program is accredited or not, because accreditation ensures quality. I'm proud to say that Texila American University is accredited by not one, not two, but three international programs. We are accredited by CAMHP, we are accredited by ACCM, and our university is also accredited by British Accreditation Council, which means we must be doing something right, to have three accreditation instead of one, which is the usual requirement, having one international accreditation. We are also accredited by the National Accreditation Council of Guyana, the country. So first thing I think as a parent I would look at is the accreditation. And like any other parent, second thing that should come to your mind is how much is going to cost me. Okay, the quality is good, but then cost might be very high. And once again, let me tell you through this forum is that ours is one of the most affordable MD program in the region. And you can go ahead and Google it or do a web search, and then you will see that ours is one of the most affordable programs. So not only we bring quality to our students, but also at a very affordable cost. So these are the two main things I would look at as a parent, whether accreditation is there or not, and whether what's the cost that it's going to cost you. Other than that, you look at the environment, what kind of environment is being offered. I think that's also very important, because if you're looking at an international medical school, you'll be sending your child away. And I want to ensure that it's a good environment. And I can tell you that, we have such a diverse student body, which is such an enriching experience for our students, because they get exposed to these 20 plus cultures from all over the world, I think, which helps them grow as a human being. And our goal here at Texila is not only to produce good doctors, but also good human beings who can play a significant and constructive role in the community. And I think the environment is perfect for that. You get exposed to a variety of cultures here, And then another thing I would look at is so the medical program is very stressful. So what things do you have in place? So it's not all about studies all the time. We have sports activities, we have cultural activities. One of the most wonderful experience for me here is to sit through this culture mingle, in which all the countries bring their own culture, their songs, dances, videos. It's just such an enriching experience for me, which I have gone through multiple of them, but I still enjoy them very much. So the environment also is really, really important in my opinion. And then, of course, the curriculum we have talked about, it should be a good curriculum with enough exposure to the variety of cases and variety of clinical patients that you have. So I think these are the things that you look into when you look for any medical program.
I think this is a perfect place for us to end the discussion, because I think it covers not only why you should choose Texila, but also some of the more important highlights. So I want to again thank Dr. Bansal for being available for this discussion. I think sometimes when students and parents are thinking about choosing medical schools, they're typically interacting with admissions team like myself or our team, and sometimes the message can get lost in translation. And I think hearing it from the Dean of Medicine for not only the basic sciences but also the clinical sciences to showcase and highlight the benefits of coming to our program in Guyana, I think it really reiterates some of the conversations that we're having with our students. So thank you again, Dr. Bansal, for taking the time today to have a conversation with us. If anybody is looking for more information about the admissions requirements or anything else that we talked about, we will be posting the discussion on our website along with the links. So you can just look at the bottom there. It will say www.tau.edu.gy. and that information will be available through us. And if you are looking for more information, or if you want to have a one-on-one conversation with Dr. Bansal, which I know that he has done in the past, please contact us at the admissions team, and we'll be happy to coordinate that. So once again, thank you, Dr. Bansal, for taking the time today to talk to our audience. If you have any other closing remarks, I'll let you end the discussion.
My pleasure, Dr. Patel. Once again, thank you for giving me this opportunity to interact. I would just summarize by saying what I started with, is that our goal is to prepare our students to be successful in the licensing exam they're going to take, have the necessary clinical knowledge and clinical skills, at the same time become good researcher and community leaders. So it's a wholesome personality development, if you put it that way, and that's what we are looking for. So thank you once again, and I wish you all the best.
Well, thanks again. I appreciate your time. Take care, everybody.